Hello and welcome to the Rise Up with Orion podcast. Thank you so much for joining us as we are diving into a little bit more about one of my favorite topics, as many of you know, sleep. But we're also really going to be layering that on top of dental health as well, because it is a dental health awareness month, believe it or not, this month. So I'd like to reintroduce our expert. Dr. Mike Bennett. He's a board certified dentist with 25 years of experience in general dentistry. Over the past decade, he's focused on treating children and adults for sleep related breathing disorders and craniofacial pain at Advanced Dental Care in Provo, Utah. So, thank you, Dr. Bennett, for joining us again. I'm so excited to see your face and dive in a little bit deeper to what we started talking about in October of 2024. So, welcome back.
Thank you. It's great to be back. Thank you, Tara.
Yes, I'm excited to dive in. As many of our listeners know, I am a bit of a sleep nerd myself. I teach sleep science at the University of Utah Lifelong Learning Program, and I'm excited to really dive in because this is one of the topics that comes up all the time, is really, sleep apnea and what happens when, we're not sleeping well and all the different things that come along with it. So I'm going to turn the mic over to you to share your expertise.
Perfect. Thank you so much. And I love your enthusiasm. I'm right there with you. Right there with you. It inspires me to think that the human body is designed to heal itself. And when sleep is working right, then those healing processes work really well.
Mm-hmm.
So, as a general dentist, in my practice, I'm all about any help that I can get to help people improve upon the therapies I'm already giving them. So, um, yeah, referring back to my previous interview with you, just there's so many reasons why I got into this, and just maybe I'll hit one or two. I noticed over my beginning of my practice that a lot of people had chronic gum disease, cavities, enlargement of the bones in their jaws. And I really didn't understand why that was happening. And they'd come back and their 6-month visits and say, "Hey, I'm doing everything you told me to do. I'm using
Yeah.
fluoride, and I'm flossing, I'm brushing, I'm eating the best foods. And I don't understand why I'm getting these cavities over and over and why my teeth are wearing down." And as I delved into the research, I found that when a person's sleep is not working well for them, their mouth deteriorates rather quickly for children and adults. It's not just adults, but it's both. It's all ages that are affected by it. And so that phrase, unleashing the healing power of sleep, is not just a trite phrase. It's what I'm
Yeah.
seeing in my practice, that if we can apply some standards of screening ourselves, and if you're a provider, your patients, for these issues, then you really are going to give them a gift. And it's a wonderful gift
Mm-hmm.
of health. And I entitled it a powerful healthcare model, potentially, as we as healthcare providers look at this, and as a public, we look into sleep and how it can really benefit us. So just to put it in perspective, if we don't sleep very well, then we're at risk for lots of medical problems. For example, just being overweight means that we're at 7 times higher risk for stroke and heart attack. But if we have blood pressure problems, it's about 8 times the risk. Smoking, we move up to 11 times the risk. But if we have sleep apnea, then we're at 23 times the risk of developing stroke and heart attack. And what kills more Americans than stroke and heart attack? Right? It's like that's up the top
Yep.
list. So I just think I'd rather be a smoker than have sleep apnea in terms of these odds.
Right.
I
And
mean,
unfortunately, it's not something that most, doctors talk about. It's not something that most people talk about when it comes to, just seeking a medical visit. So,
yes,
I'm glad we're talking about it today.
so true. So it increases our risk more than any single factor. And 80% of sleep strokes are caused by sleep apnea, according to literature as well. So it's something we should definitely look into. So I thought I'd give people, well, what do I do about this? Yeah.
Hmm.
So here's some steps, and I'll just kind of rush through them quickly. First is get informed. You're here, you're listening to this webinar. I'm going to give you lots of information. It's like drinking out of a fire hydrant at times, but you fill out some forms, you observe your child, yourself, and there's some great videos out there. We can give you a QR code link to look at, and then just have a consultation and see, hey, is there something I can do about this, or am I a good candidate to be screened? Then
Mm-hmm.
you come in for an appointment, we discuss it, we might do a sleep test where we always have board certified sleep doctors review the sleep results. And then we do a scan of the mouth, the upper airway, and we talk about it. If you have sleep apnea, we want to know what anatomy is blocking your airway. And so we'll review all the findings and look at your nose, your throat. Is there any blockages in there? It could be your valves are narrow through here.
Mm-hmm.
Sometimes athletes wear breathe right strips to open their valves. And then sometimes you have a deviated septum or enlarged turbinates, or you have an enlarged uvula, or your mouth is small. And whenever you bite down, your tongue gets pushed back into your throat. And so your throat could be crowded by a larger tongue, or a normal tongue rather, and just a small mouth.
Mm-hmm.
So we look at all of those things, and the whole goal is what is blocking the airway? What's the plan for each of those blockages? And who needs to be involved in helping that? And I routinely work with ear, nose, and throat surgeons and allergy specialists, and anyone who could improve the human upper airway, I'll work with them. So why should we care? Well, one of the reasons is it costs so much if you don't treat this, because now you're chasing your symptoms,
Mm-hmm.
high blood pressure, multiple organ failure. And there's estimated to be about $150 billion of healthcare costs associated with this untreated issue. And that doesn't even include all the car accidents that are out
Yeah.
there happening, or the unproductive people at work. You know, if I'm yawning, I can't get my job done. And so it takes me twice as long to get
Yes, falling asleep at work.
my yeah, none of us have ever done that, right?
Never, no.
Never. So there are lots of issues, and it turns out that the Dental Association, American Dental Association, have identified that these things are happening in the public healthcare space, and they're saying, hey, you dentists, really, since you're looking in mouths all the time, why don't you start screening your patients? Dentists see patients, people, next to dermatologists, dentists see people more often than any other healthcare provider, according to some surveys.
Hmm.
And so why not screen the public and identify these and then refer or help treat, et cetera. But the American Dental Association, almost 8 years ago now, they're saying dentists should screen. So anybody listening to this, ask your dentist to screen you for sleep disorder.
Yeah, and hopefully people are going to the dentist twice a year, you
Yeah,
know? So if
yeah.
you're not, maybe there is some encouragement to do that as well.
That's right. And especially if you're having the dentist tell you, hey, you have gum disease still and you have more cavities, like, doc, could you screen me for sleep disorders and just
Hmm.
see if that could possibly be contributing? Remember, a dry mouth will allow bacteria to stick to the teeth and gums, and that bacteria infects those structures. You have a higher rate of dental problems. So anyway, there's the paper, but basically they just said, dentists, you need to do this, and
Hmm.
and that will help the public health. So what is sleep apnea? I want everybody to get a
When
visual of
we
this.
breathe, air travels down the throat, through the windpipe and into the lungs. The narrowest part of that pathway is in the back of the throat. When we're awake, muscles keep that opening relatively wide. But when we sleep, those muscles relax. That narrows the opening. The air passing through may cause the throat to vibrate. That causes snoring. Obviously, many people experience this. But in some people, the throat closes so much that enough air doesn't get through to the lungs. When this happens, the brain gets a message to wake up. The brain quickly activates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This only takes a few seconds. You may not even know you've awakened, but this process may happen over and over, hundreds of times, all night long. You may never get into the deep, restful stage of sleep. As a result, you may feel exhausted when you wake up and feel sleepy all day. Many mistakes and serious accidents are caused by sleep deprivation.
Okay, can we relate to any of that? The sleeping partner who's irritated?
Right. Well, and that's what I was thinking as well is, obviously, a dentist can identify it for someone who maybe is sleepy, but again, there may be some things as a sleep partner, a bed partner that we could
Mhm.
identify just from how things sound as well.
Oh yeah. And I didn't realize I hadn't not the foggiest idea that as a dentist I'd be saving marriages.
Mm-hmm.
Literally
Yeah.
helping
Well,
people to be able to maintain relations and sleep in the same bed because we finally fixed a person's sleep. I remember one couple had 3 kids, and he said that they had never slept in the same bed in the
mm,
5.5 years of marriage. And
right.
and we identified the anatomy, got him fixed, and he's not fixed in a bad way, fixed in a good way.
Sure.
He's now able to have a better marriage life. And so
Yes. Yeah, that's great.
yeah, yeah. And you notice in that picture that when the airway closed, the guy jerked, his head
Mm-hmm.
jerked around, and that movement, it's called parafunctional activity. That's an arousal. And when that happens hundreds of times per night, the nervous system is being upregulated. The
Mm-hmm.
blood pressure increases. And so if we have high blood pressure all night long, what does that do to all the organ systems?
Right. Yeah,
Right?
and I can only imagine, cortisol is just going to continue to be pumped, that stress hormone. You're always
Yep.
under state of stress.
Oh yeah. And how hard is it to lose weight when you have constant cortisol pumping? And then
Hmm.
and then what does that do to your adrenal glands when they're
Right.
constantly being stimulated? So adrenal insufficiency, all kinds of things. So it's easy to see how you could chase symptoms and be under treatment your whole life because you're just not getting your sleep quality fixed.
Hmm.
So
When we
so
breathe,
let me stop this
when
and
we
go to
breathe,
the next. All right, guys. Okay, so the definition of sleep apnea is when your breathing stops 10 seconds or more and your oxygen drops 3% each of those times. And if that happens 5 times an hour, then as an adult, you're considered to have sleep apnea. If you're a child, then it's 1.5 times or more per hour if you
Mm.
have those apnea events. So if everybody on this call could hold your breath, take a deep exhale and hold your breath, we'll count. It's hard for even 5 seconds.
Yeah, exactly. It's a very long 5 seconds.
Yeah. So, but if it's 10 or more seconds, that's one apnea if your
Mhm.
oxygen also dropped at the same time.
Wow.
So that's what sleep apnea is. And if this happens a lot, I put chronic fight or flight can lead to organ failure. And so that's an important message for all of us to hear. So when has this actually helped in the lives of everyday people? There's a great video that was posted on YouTube a while back called Finding Connor Geegan. And oh, let me go back. And this just touched me when I first saw it. So it's the words are in text, closed caption. So I'm going to read this to you. But this is a mother, Valerie Deegan, who talks about her son, and it's heart-wrenching to think about what this young boy went through. And it turned out to be an airway problem. It wasn't a psychosis issue that they thought originally. So finding Connor Deegan. I can't tell our story without starting from the beginning. Little baby. My son was never an easy child at birth. He was temperamental, demanding, complete opposite of eager to please. Year 2011 was the straw that broke the camel's back. My son was always in center of attention, negative attention. He was throwing tantrums at home. He hated me and the world. The expression we heard the most was, "I wish I was dead."
Hmm.
That was that. He was always tearing up his homework and bullying someone. Seemed to be no rhyme or reason for his behavior, no trigger. I could ask him to throw something out one day and he would do it without a fuss, but on other days, when given the same request, he would throw himself on the floor in full tantrum at age 11, 10. His report card in 4th grade consists of D's and F's with a lot of negative comments. Teacher said he was gifted, but he had challenges. My son was not behaving the same way as other kids. His ability to conform to follow directions at home was too much for everybody. The school wanted an individual education program where they'd expel him. So out of desperation, she signed the IEP, and contacted several people. And contacted their pediatrician, requested allergy testing and sleep test to see if there's a medical issue. They enrolled in a parent-child interaction therapy 2 times a week. One decision I regret most was the full psychological evaluation because it labeled him. She said the sleep study results from the hospital showed snoring arousals, partial arousals, bruxism, upper airway resistance, and obstructive sleep disorder breathing. Allergy results stated that he has allergies to pets and several types of trees. Took the psychologist 4 to 6 weeks to put together the eval results. The psych eval concluded, without taking into consideration the allergy test and sleep test, that the child had cognitively gifted, he was cognitive, but he had defiant syndrome, obsessive defiant disorder. So they pointed them in the direction of getting some allergy medication to treat the nasal congestion and to contact the local dentist. See if there was this case study in this. So how's a dentist going to fix this, fix the behavior of a child? Understanding the domino effect of undiagnosed airway problems helps. When someone cannot breathe through his nose, his only other option is mouth breathing. If that's done 24 hours a day over a number of years, it takes a toll on the development of the mouth, airway, and the child. So true. A higher arch is developed in the palate. Jaws no longer able to accommodate the tongue, and tonsils and adenoids enlarge. And these contribute to an obstructed airway. Junpei had 1 year of treatment with an interdisciplinary team of doctors. Tonsils and adenoids are removed, remodeled muscle attachment under the tongue, expanded dental arches, daily doses of allergy meds to improve his airway and sleep. And I am able to proudly introduce you to my son. We found Connor Deegan. Isn't that sweet?
Amazing.
I knew he was there the whole time, she said. I once read somewhere that if a room was full of children, 1/2 of them diagnosed with ADHD and ADD, the other half were suffering from sleep deprivation. That's Karen Donegan. It's because of their signs and symptoms were identical. Every sleepy child should have a sleep screening. And a picture of a cute kid on there. My son's future bright, looks bright. He traded his D's and F's for A's and B's. And what a sweet story, huh?
My gosh, and as a parent too, to navigate that, I
Yeah.
can't even imagine the toll that it took on, the parents to go through years of just, wondering how I can help my child. So look at that.
Mhm. Oh, yeah. And just think that child's going to school and now he's labeled with what is it? A defiant disorder, compulsive defiant disorder. And now he's going to be cornered into some educational program and when the whole time he couldn't breathe.
He's just tired.
Just tired, poor kid. So that mother, and I love what I do because I hear parents talking about that all the time. Once my kid has started breathing again and sleeping, they're not wetting the bed, they're thriving in their lives at a level that they weren't before. It's just a lot of fun. So what does it look like? So if you're a parent, you're looking at your kid or looking at yourself in the mirror, what are the signs of it? This is a great picture because this is showing a lot of different things that sleep disorders looks like. So if we breathe through our mouth a lot, if we have poor sleep, if we're waking up multiple times through the night, if we have chapped lips, I mean, you look at the eyes of the kid, those eyes are tilted. There's darkness under the eyes. That's edema. Allergic shiners. Notice the nasal nostrils. They're so small. He's not using them very much. Inflamed, if you looked in his mouth, you see inflamed gums, swollen gums. That's the venous pooling I mentioned. The forward head posture, you see the head tilt to one side. And because of that, you're going to have neck, shoulder, back pain because of these posture issues. You're going to have enlarged infected tonsils. Just have your kid open up really wide and say, ah, and look back there. If those are enlarged, there's a good chance they're mouth breathing. Those glands, they get so dry that they get infected. They don't get washed clean, so they enlarge. And there's reflux up the your eustachian tubes. And so frequently we get ear tubes placed in a child when oftentimes that eustachian tube is overly worked because they're trying to jaw thrust, maintain an airway, and a lot of reflux is getting up there. And so there are problems with that. So The hearing can be affected, ringing in the ears, excessive facial vertical development. You see the child's face is kind of along. Because when you think about, put your hand on your chin and then breathe through your mouth, and you'll notice that your jaw goes down and back. And
Yep.
that's how the growth occurs. If you're a child, you're going to be down and back, and that turns into a mouth breathing episode, but your jaw and your mouth ends up being a lot more crowded as well. So you have dental problems and orthodontic problems like an open bite, and abnormal swallow patterns are also an issue. Bruxism, when the teeth are wearing down or clamping your teeth together a lot through the night, that's a survival reflex. Just indicates your body's in a lot of chaos and stress trying to escape from this terrible situation of suffocating. And then bedwetting is frequently an issue. We grow out of that as adults, but what we're doing is we're actually waking up. We don't have enuresis. We're just waking up, and children don't wake up. They just pee in their bed.
Right.
Adults, we wake up and we go. So you could think of it as impaired mouth syndrome, as sleep apnea, because it turns out that it's not a fat person problem. Obesity just makes it worse. It turns out it's an anatomy problem. It's an underdevelopment. And why does that happen? Like with Connor Deegan, why were his jaws underdeveloped? Well, here are some of the things that anthropologists are coming out with. They're saying that if there's limited or no breastfeeding, that won't develop the jaws of the baby as well. And when we eat a lot of soft and processed foods, that creates allergies, and it doesn't stimulate the muscles of the face and jaw well enough to stimulate the bone growth. And then allergies, of course, that means our nose isn't working. We have to mouth breathe. And then it results in weak tongue and lip muscles because we're using our mouth as our breathing tube. And then the bones are stimulated. It's interesting. You go to the gym and you think, I'm building my muscles. Well, in reality, you're building muscles and bone because you need the supporting structure. And then, of course, oral habits, things like thumb sucking, pacifier, excessive pacifier use, and adverse swallowing, that all contributes to underdeveloped jaws, which then contributes to a small airway, which contributes to sleep disturbances. So those are the dominoes of those things that we need to be thinking about. So there's some researchers that tested that theory, and these poor little monkeys, but they put these silicone plugs in the monkey's nostrils, and it turns out that the monkey developed an open bite and crowded teeth over time. And then when they took the plugs out of the nose, the teeth went back together because the tongue was now able to do its job. The tongue is the orthodontist of the face.
Yep.
The muscle isn't in the jaws, it won't stimulate that growth. So here's an interesting video. I think this also makes the connection.
The normal or physiological way of breathing is through your nose. Breathing through the nose permits to purify the air by the structures inside the nasal cavity. In that way, the air entering into your naso and oropharynx, your throat, is not going to heavily affect the lymphoid tissue in the adenoids and tonsils, which is the last barrier to catch harmful particles in the air before it reaches your lungs. Besides clearing the air from harmful particles, nasal breathing stimulates the production of gases and substances in the nose, which are going to facilitate the entrance of the air in the lungs and prevent infection in your respiratory system. Mouth breathing allows the air to pass directly into your throat, where the adenoids and tonsils are located. In that way, the air entering into your body through your mouth has not previously been purified, and the lymphoid tissue in the adenoids and tonsils become the first defensive barrier against the harmful particles contained in the air. As a consequence, that lymphoid tissue overgrows, occupying a large volume of your throat. That makes more difficult for the nasal breathing, and you make a habit of breathing through your mouth. In order to breathe through your mouth, your lower jaw has to come down, as well as your tongue has to rest on the floor of your mouth. Breathing through the nose is the correct way, and so the tongue is able to rest on your palate, stimulating a normal growth and development of your upper jaw.
Yes.
Conversely, when you breathe through your mouth, your tongue has to descend and protrude. At the same time, the pressure of your cheeks increases, pushing the upper jaw inwards. So the growth and development of your upper jaw is negatively affected, resulting in a narrow and high palate. The upper dental arch acquires a V shape instead of being a rounded dental arch. Therefore, your teeth do not have space to properly align.
Okay, so now we know how teeth get crowded. Excuse me. It's not genetics, it turns out. It's not gene mutations at all. It's epigenetics. It's in our environment that creates these situations. So, sorry, I meant to just pause that.
The result of this deformation of the upper and lower arches
sorry,
is the presence
guys.
of premature
Preview. Okay, I'm going to skim forward because now we know how teeth are crowded.
Techniques increases swallowing function. Every time you swallow, between 1,600 to 2,400 times per day, the tongue positions low, staying away from your palate. That forces the tip of your tongue to position between your upper and lower front teeth. That pushes your front teeth to show out of your mouth and your tongue resting on the floor of your mouth with the tip of the tongue between your front teeth. That is called an open bite, as your upper and lower front teeth do not touch when you close your mouth. All those dysfunctions, mouth breathing, incorrect tongue posture, open mouth, and incorrect swallowing are going to continue affecting the growth and development of your upper and lower jaws. And as a consequence, there is less room for your teeth and they become crooked. Remember, the nose is for breathing and the mouth is for eating. Breathing through your nose and keeping your mouth closed with your lips together is going to help your upper and lower jaws to grow and develop better. But more importantly, it makes you healthier.
All right, what'd you think?
I'm just figuring out where my tongue is while I'm listening to that. I was like, where is my tongue? Is it on the top? Is it the bottom? What's going on in my mouth? It was so funny just to think about it. And very rarely do we do that. We just go through life breathing and we don't think too much about it.
Yeah, isn't that something? And it's so true. And if our tongue isn't up on the roof of the mouth when we're exercising, walking around, then we're going to have all of these issues because the nose isn't doing its job to filter our air.
For sure.
Interesting, nitric oxide is being secreted into our air as we breathe it. It goes into our lungs and that facilitates that oxygenation effect. So we get 18% more oxygen nose breathing versus mouth breathing. So who doesn't want
So
more?
interesting. Okay, use your nose. Use your nose.
Use your nose. Yep. Mouth is for eating. All right. So if we have head, shoulder, neck pain,
The result of this
here's an
deformation
interesting
of
connection.
the upper and lower arches is the presence of premature contacts upon closing.
So the
which
mouth
shift the lower
changes
jaw distally off of the physiologic
can
trajectory.
affect the
The
joint of the
narrowing
jaw.
of the upper arch pushes the lower jaw back.
Pop.
This forces the TMJ condyle to shift distally while the TMJ disc shifts forward. Upon opening, the disc can shift onto the condyle to restore the TMJ's correct position, reduction of the disc, and then shift back to an incorrect forward position upon closing. This is what causes a reciprocal click. In addition, the muscles could be in a state of hypertonus or spasm, which can result in tension headache. An incorrect position of the lower jaw can result in parafunctional activity of the muscle.
Okay, so we found that the change of the bite can cause our jaw to set differently and we'd start dislocating ourselves. And so who doesn't have popping or clicking in their jaw every once in a while?
No kidding.
Yeah.
Yep.
And over time, as we pound our teeth together, we start to push our jaw more back because our teeth intrude into the jawbone from all that pressure. So we develop TMJ disorders. And I'm treating people all the time with chronic pain that are just debilitated with migraines, headache, jaw pain. So it's often related to a lack of nasal breathing and having sleep disorder breathing.
Muscles, such as clenching and grinding. Over time, grinding can result in severely worn down teeth. As a result, the teeth become even shorter, the lower jaw shifts distally even further, and the vertical of the bite decreases. In time, joint degeneration occurs. The joint becomes deformed, and the ligaments of the joint become damaged. As a result, the TMJ disc can get trapped in front of the condyle. While the click may go away, limited mouth opening will occur.
Okay, so lots of issues there. with chronic pain. So what happened to the human beings 400 years ago before we got into the malnourishment of our food supply? Well, they had big jaws. They had plenty of room for 32 teeth and even spaces between them. So researchers went around, they found people who were eating whole foods, and they found they had nice, beautiful, big arches. It was excellent. Here's what an ideal mouth should look like in a child. Spaces between the teeth. You should be able to see the bottom teeth as well as the top teeth when they bite down. And then here's an example, and it's hard to actually find ideal adult mouths, but you want roughly 38, 42 millimeters across. So mouth breathing, reverse swallow, you can see the profile, how it develops back, and which child has the best airway. Well, let me tell you, the one on the left does. They're breathing through a garden hose versus a coffee straw, the one on the right. And so look in the mouth, look to the side of your tongue, see if you have imprints on your teeth, and then notice also the teeth are flattened, worn through. You see dentin exposed. And here's a severe case of this. When you see this, the mouth is over collapsed and airways small. You can also look in the back of the throat. And if you see a hole there, that's good. If you don't see a hole, that's bad. You have high risk. And here's an example of what that looks like. Here's the researcher that was referred to in that Connor Deegan story, where she said that if you have ADHD and ADD, they couldn't tell the difference in your symptoms with children that had sleep apnea. So interesting thing to have that checked out. Here's a case that I did, and this young man was on 3 medications, 2 for allergies, 1 bronchodilator, and some reflux meds, and just very much a recluse, non-social, and bedwetting a lot. Anyway, by treating him, just opening up his oral airway, he was able to have all of that reduced or resolved completely. And so there's an x-ray of his airway. When it looks red and black, that's bad. Multiple colors, that's good. It's nice, wide open from using the growth stimulating device. And even growth is improved. When you start getting REM sleep, you get growth hormone and they start shooting up. There's one of my favorite cases, Down syndrome, 18-year-old. Almost all Down syndrome have sleep apnea because of mid-face underdevelopment. And so we developed his mid-face. Novel idea, and we improved his airway. He had lots of allergies. He was very irritable all the time, according to his mom. And through this treatment, he really improved. Notice the nasal space increase. Black on an x-ray is space. And there's a lot more black showing on that right side. And here's the mom talking about, I won't go into it, but she just says, just grateful. He's not as irritable anymore. He understands us. He cognates better. He's just doing better overall in his life. And here's some examples of treatments that we'll do. The expander device, for those that maybe not tolerate a removable device, they'll lose it or whatever, we'll glue one in. And sometimes nighttime wear with a face pull mask they'll use. And then these blue devices, they're thick, that stimulates the bone and the muscle to grow. So we develop out, and we start kids as little as 18 months, and we'll replace the pacifier with one of these to help them develop out.
Is that similar to what you would do with an adult as well? Someone whose, mouth is already developed, or do you use totally different treatments for adults?
Well, it's similar actually, except for adults will use more removable therapy. Yeah, 14 to 16 hours every day they'd wear it. That includes sleep time, and that could grow their airway out. We do things like correct breathing. This on the lower left, this is a sleep device that we'll have them wear at night and establish a baseline test to see, and then we send that to the physician to read. And here's what a device looks like. That's the growth guidance device. Sometimes I'll use this in adults if we want to develop facial jawline, cheekbones, musculature. Once they're all developed out, they'll exercise in this. And so when should you start? Interesting thing is, if you wait till age 12, then 94% of females are completed their facial growth. So you want to start way young, even as early as 2 or 3, if you start to see this underdevelopment, besides the fact that they're going to have better cognition, organ development during their growth years if you can get their breathing and sleeping right now versus later. So summary of treatment options. If you're an adult, you can have jaw surgery, you can have removable devices, you can have glued-in devices, and you can have non-permanent things. When I say permanent changes, I'm talking about actually changing the growth, the shape, the space, either through surgery or non-surgical methods. But the non-permanent ones are CPAP and mouth devices. And those are good, but the downside is your apnea will get worse over your lifetime being on those, and you become more and more dependent on them.
Mm-hmm.
So we can use some augments like nasal supports and weight loss and food, things like that. So I wanted to give everybody an idea of what we do for adults. CPAP is the tried and true. But the problem is it's hard to tolerate. After a year, about 70% of people drop off wearing it.
Yeah, well, and talk about the sleep partner as well. I have that a lot in my sleep classes is,
Yeah.
I have to deal with this, my
Yeah.
partner wearing this constantly and
Oh,
it's tough. It's a huge adjustment.
Yep. You're trading one irritation for another irritation. So here's one cool innovation now. As dentists, I'm in beta testing, making devices in my office. So within a 24-hour period, I can have a device like these made for a patient. They have straps that help to hold the jaw forward. This is the basic concept. On the left, the airway's small. With the device in, the airway's larger. And with the tongue exercises, suction cupping the tongue up and the nose open, we can treat mild to moderate sleep apnea. And even the severe cases, we can augment what the CPAP is doing so that the pressures don't have to be as high. And so we use in combination. So here's another type. There's like 150 different types, but the ones that don't crowd the tongue space, I like the best in general. And so you asked about in adults, what can you do to expand? This gentleman, Dr. Dave Singh, he developed a thing called biomimetic appliance therapy, where you can wear a device and over time you can grow the mouth and thereby grow the airway. That's why the little red thing on the right is bigger, because the mouth is bigger, more space.
Wow.
And then here's another view, narrow to large, and that also helps with posture too. The head becomes more upright. There's other things like Inspire. It's an implanted wire in the tongue. People have heard about that. It only deals with the tongue part though. We still have to do something through the nose and the soft palate as well. And it's an invasive surgery and it's costly. It's 70 plus grand. I've heard from one patient, 6-hour surgery.
Wow.
Here's another surgery. You can do that to advance your bones forward, to open things up. For severe cases, that's a good thing. And then airway problems, we can open things up with a laser that stimulates that soft palate and uvula to shrink it and kind of pull things out. This is something I do in my practice as well. So why start now? Enjoy great health now. Right? Have a higher IQ. There's lots of studies that show sleep deprivation affects IQ in children and adults, which makes sense. None of us feel like thinking when we're tired. You just perform better in life. You save money over a lifetime, and then you unleash your health. And then back to kind of how to do this. Let's get informed. Contact the office. Let's have an appointment, and let's just talk about it and review the data. Sleep tests, CBCT scans. Some people have asked, well, what does it cost? Well, if you just want to come and talk about it, right now I'm just charging $85 for that. If you want to do a sleep test and you're a child, I'll charge $200. That pays for the physician to read it. And then that gives you a full treatment plan. And then for adults, you'll get a large scan, 3-dimensional scan to look at your airway and the sleep test and report from the physician, and then a full treatment plan to address every point of your airway issue. And then we just move forward. And if treatment can run anywhere from $2,800 to $8,800, typically, and that'll change based on geographical areas. Insurance can cover, because it's a medical condition, they can cover it. But a lot of insurance companies have loopholes and things, and you have to try CPAP for a while and maybe try something else. And so it's definitely worth going down the road. You start sleeping, you start breathing, you start enjoying greater health and happiness. It's awesome.
For sure. I love it. Yeah. So one of the things that I was thinking of is, obviously I welcome everyone across the country that's part of Orion to fly to Dr. Bennett's office.
Yeah.
But if that is not something, What is your advice, Dr. Bennett, on how people can find someone like you across the country if, coming to Provo, Utah isn't within their, you know, flight
Yeah,
schedule?
I think they can. I think they can search online, and a lot of dentists are really becoming enlightened. This is the wave in dentistry, and they will publish on their website that they're doing Airway.
Okay.
If they have anything in their website that says Airway focused or Airway centered or sleep centered, that
Hmm.
means they have an orientation. And then just to call and say, hey, do you guys screen your patients for sleep disorders? And if they do, it's not easy to do to get out
Right.
of the routine to screen, but those that do it, they really benefit their patients a lot. So they can do that.
Yeah, and I think so much of it just asking the question as I think about my, every twice a year dental visit, we're not talking about sleep, we're not talking about airway, we're talking about, mouth cancer and, those things. But again, asking those questions, I think, empowering everyone just to ask those questions. If they have a dentist that they love and they're comfortable with,
Yes.
ask the question and see if it's something that they've thought about or that they do, and you might be moving them in a great
Mhm.
direction.
Oh yeah. And I know lots of dentists around the country too, that if they want to call, I'm happy to refer them to somebody if I know of it, somebody in their areas.
Amazing. Amazing. And what I love about this podcast today is it's really just a place to start. I know
Mhm.
Dr. Bennett, you're not here to scare people. You're just here to, open their eyes up to something that potentially we've never thought about before.
Absolutely. And I want to prevent suffering. I want to prevent disease.
Hmm.
That should be the thing that should be exciting is how do we prevent that for myself and my family? And the scary part is suffering through diseases that we could have possibly prevented had we
Hmm.
just gotten our sleep fixed and other things. So
For sure. Yep. Ask the questions. I love it. Just make contact.
yeah.
Again, the best quality of life for ourselves and our kids. I think about it. I put, braces on my kids when they were, in second and third grade, and I think so much of it is we're starting so early and, there's a
Yeah.
benefit to doing that.
Yeah, for sure. Absolutely.
Perfect. Well, thank you so much. For those that are just listening to this podcast, check out the show notes. We are going to post a copy of this presentation there. So if you didn't see some of those visuals, check it out because I will post those in the show notes, as well as how to make contact with Dr. Bennett at Advanced Dental Care in Provo, Utah. I'll leave his phone number there as well. For any contact that you would like to make. So, Dr. Bennett, thank you so much. So informative. I love it.
You're welcome. Thanks for having me, Tara.
Yes, thank you. Have a great day, and thanks for joining the Rise Up with Orion podcast.
Thank you.